Hello, and welcome to another segment of Let's Get It Straight. I'm Katherine West, Infection Control Consultant, and our topic for today is going to be just a little bit of a discussion about where we stand with bird flu in the United States. Our objectives for this session: review the history of avian or bird flu and where it originated, understand how it is transmitted, identify current status of the disease in the United States, and understand what role seasonal flu vaccine might play. Perhaps a good starting place is to talk about terminology. What does low pathogenic mean versus what does highly pathogenic mean? So, talking about low or high, what it's talking about is the potential for the virus to kill chickens. This does not have anything to do with how infectious the virus may be to humans, other mammals, or other species of birds. So where did bird flu originate? It's been determined that it came from the Guangdong region in South China. This area has many lakes and rivers and a lot of wetlands, which is great habitat for aquatic birds. These birds are natural hosts for low pathogenic avian flu. It was actually here in 1996 that the first case was diagnosed in a farmed goose. The goose had highly pathogenic strain of the virus, which we know today as H5N1. Now, if Guangdong sounds familiar to you, this was also the area for the origin of the SARS virus. The last outbreak of concern for avian flu was in 2006-2007, where we had cases occur globally. And this was when we were put on notice to begin to plan for not just a sustained outbreak, but possibly a pandemic. The source of this organism is the fecal material, and it can be transmitted through inhalation of nasal secretions. Our risk at the time of previous outbreaks was poultry farms, and workers on poultry farms were then outfitted in personal protective equipment, quite a lot of it, because they're charged with sweeping up animal feces and handling infected birds and items in their workplace. So personal protective equipment for these individuals was quite extensive. But what's new? What's going on currently with bird flu? And we're going to discuss this in the terms of the United States. The virus has been, for the first time, identified in cattle. And this raised concerns about the safety of milk. How the cows became infected, we think that there might be a link to barn cats as a source. But the safety of milk has been investigated. The Food and Drug Administration has carried out extensive testing and it has confirmed that the process of pasteurization kills this virus, that there was no live virus found in milk samples or in samples of infant formula or products for toddlers. It's also been determined that cottage cheese and dairy products are also safe. We were asked, in particular, not to drink raw milk. Raw milk has not been subjected to the pasteurization process. There's also no evidence that individuals can contract bird flu from improperly prepared or cooked foods such as eggs, chicken, and beef. The United States Department of Agriculture is now requiring any cattle that would be transferred from one state to another is required to be tested for bird flu, and that there be proof of a negative test for influenza A virus before transfer of cattle can occur. So what is the incident rate in dairy cattle herds here in the United States? Thus far, 36 herds in 9 states have tested positive for H5N1. 10% of them presented with symptoms. All of the animals returned to their previous levels of production after they recovered, and recovery time was deemed to be about 2 weeks. The incubation time is listed at between 2 and 8 days following exposure, and cattle are monitored for 10 days after exposure. Transmission. In almost all the cases that have been documented so far here in the United States and in other countries, human bird flu infections have come from contact with infected animals. Signs and symptoms that were established for bird flu back in the last outbreak: that for human cases, an individual would present with fever, a cough and sore throat, muscle aches, eye infections, pneumonia, and respiratory distress. Now, we have had in the United States 2 human cases of bird flu. The first one occurred in 2022. It was diagnosed in a farm worker in Colorado. That individual was treated and has fully recovered. The most recent case occurred in a dairy farm worker in Texas in April of this year. This individual presented with only one symptom, and that was conjunctivitis. The individual was treated and has fully recovered. How is a diagnosis of human bird flu obtained? A nose or throat swab can be obtained and tested for real-time reverse transcription polymerase chain reaction testing, and this should give us our answer. Risk groups would include poultry and livestock workers, backyard bird flock owners, veterinarians and their staff, animal health responders, public health responders who would go to investigate an area possibly infected, and animals and workers, as well as slaughterhouse workers would also be included. Recently added was an expansion of the screening of wastewater for influenza A virus subtypes. Currently, over 600 sites are reporting data on influenza A viruses. Now, the testing from the sewer system does not distinguish between H5N1 and other types of influenza A viruses, but if there were any noted increase, public health officials, CDC, would be made aware of that. How about seasonal flu? Does flu vaccine offer any protection from bird flu? Well, we can go back to our last outbreak, where it was believed that the flu vaccine offered some protection from bird flu. However, at this point in time, it is felt that seasonal flu vaccine will serve to reduce the potential for co-infection, someone acquiring seasonal flu and bird flu at the same time. It is especially important that people who may have exposure to infected or possibly infected birds or other animals get seasonal flu vaccine as a prevention. And ideally, that should be 2 weeks before any potential exposure. Seasonal flu vaccine does not protect from bird flu viruses, but can reduce the risk of getting sick with human and bird flu viruses at the same time. I mentioned that the 2 previous human cases, the one from Colorado in 2022 and the one identified in Texas in April of this year, were both treated with antivirals and both have recovered. They were treated with Tamiflu, so a drug that we have in our stockpile program and that is available to even the general public. You may be wondering, what about us? What about EMS personnel? And what protection can be offered to us if we transport a patient that is identified as having H5N1 bird flu infection? Well, first of all, let's remember the Ryan-White law and the updated disease listing that came from the update to the Ryan-White law. In 2011, the CDC updated the disease listing for which hospitals were required to cooperate with you with regard to any exposures that may have occurred. Now, with regard to airborne and droplet, it is the responsibility of the medical facility to notify your designated officer if a crew transported someone suspect for or diagnosed with one of the diseases on the list. And influenza A viruses are listed. So you would receive notification. As always, hand washing remains our key protection, but we have to make sure that we remember that hand washing with our antimicrobial solutions, our alcohol-based foams and gels, is to be a temporary measure until we can do a good hand wash procedure with soap and water. Now, bird flu is a droplet transmitted disease. So with those illnesses that are transmitted through droplets, we perform source control, that we give the patient a surgical mask or oxygen mask to wear. And this would be appropriate for anybody with signs or symptoms. Remember, source control means control at the source. Block the secretions from that patient to you. Remember also that our vehicles offer us built-in protection from airborne and droplet transmitted diseases. That includes your rear exhaust fan and placing your heating or air conditioning on the non-recirculating cycle. The rear exhaust fan is part of a vehicle specification. It acts to exchange out all of the air in the back of your vehicle, a minimum of every 2 minutes. So nothing hangs around back there. If you're advised that you had transported a patient suspect for or diagnosed with bird flu, we need to clean with soap and water. This is always the case. Nothing removes the responsibility to clean before we can achieve disinfection, because visible dirt and debris has to first be removed. Then we can disinfect with an EPA-approved disinfectant that has the label claim by the manufacturer that it kills influenza A viruses. Well, what about a protective vaccine for us, humans? Well, there's some positive news on that front. A candidate vaccine virus is an influenza virus that's been prepared by CDC and World Health that can be used by vaccine manufacturers to produce a protective vaccine. Currently, 2 existing H5 candidate vaccine viruses that are designed to assist with the current outbreak are available, and these are currently being used in early clinical trials and are being evaluated for safety and immune protection by 2 manufacturers. You know, due to technology today, it has not taken a great deal of time for vaccines to protect us to come into the marketplace, even when something new has been identified. So I will keep you up to date as this progresses. I think it's also important to remember that according to the World Health Organization, as well as the CDC, that the health risk posed by H5N1 avian bird flu is low for the general public and low to moderate for those who are exposed to infected animals or their contaminated environments. Keep that in mind. Well, we've come to a close for this brief review of what's going on currently with bird flu in the United States. If you have any additional questions, please feel free to contact me by phone or email. And as more important information comes to light, I will be happy to share it with you. Thank you for your time and attention, and please join me once again in the future for another episode of Let's Get It Straight.